How you doing? All right. So this was Vic from Vic-Nclex Prep. So walk with me through this NGN question. So let's go. So you have a client is admitted with acute post-streptococcal glomerulonephritis. Now indicate whether each finding is consistent with glomerulonephritis, nephrotic syndrome, or both. So this question is testing us on those signs and symptoms that is more peculiar to glomerulonephritis, and then the signs and symptoms that is peculiar to nephrotic syndrome, or that we see both in glomerulonephritis as well as in nephrotic syndrome. So for you to be able to attempt this question correctly, you have to have a knowledge on what glomerulonephritis is and what that of nephrotic syndrome is. All right, so let's just do a recap of glomerulonephritis and then do a recap of nephrotic syndrome, and then we'll now come and then answer the question, right? Now, when we talk about glomerulonephritis, what comes to your mind? In glomerulonephritis, we are having problem with the glomerulus. There's inflammation of the glomerulus. Of course, the most common cause Nclex usually tests is due to what? Post-streptococcal infection. When a child has strep throat or sore throat, you see then they will have this condition because your immune system, when your body is infested with streptococcal bacteria or infection, your immune system responds violently by producing an antibody antigen complex that goes and take care of these bacteria. In producing that, this will have so much in the body, and some of these antibody antigen complex, they will land in the glomerulus, and then they will damage that capillary, and then things will start leaking through the capillary. Remember, let's look at how the Bowman capsule is, how the glomerulus and that of the Bowman capsule, right? Now, when you look at the glomerulus, it's a tuft of capillaries that is found in the Bowman's capsule. Now, I kind of use my Bowman capsule as like a colander. I don't know what I know a colander. Colander is that thing that we use to sieve our rice. You know, when you're parboiling your rice for the first time, you want to wash it before you cook it, right? Now, after parboiling the rice, you want to separate the rice and the water. What are you going to do? You're going to pour it inside the colander, right? The rice will stay on top, the water will come below, right? You separate it. That is how that colander is how your glomerulus is a tuft of capillaries. So blood comes, pours it, and then it filters, right? Now, when you look at that mechanism, blood does not pass through that filter. Protein does not pass. So many things doesn't pass, and the ones that finally escape, it will be reabsorbed as it passes through the nephron. Are you following? From the proximal convoluted tubule to your Henle lobe to your distal convoluted tubule, they will all be reabsorbed, right? In glomerulonephritis, there's damage with that sieve. There is damage with the capillaries. So when blood comes, some of them is going to be what passing through. So in glomerulonephritis, we're going to have massive proteinuria. I say massive protein, yes, sorry, massive hematuria. That's what I want to talk about. We are going to have what? Massive hematuria. Now, this massive hematuria, they're losing a lot of blood. Of course, by the time you now check their urine, it will be Coca-Cola color or tea color their urine because it's filled with blood. Now, as they're losing this blood, what is going to happen is what? Their intravascular volume will drop, and the renin aldosterone angiotensin system will be activated, which is going to try to elevate that blood pressure. So in doing that, they will go become what? Hypertensive. Are you following? Now, because in glomerulonephritis, we are not losing protein. Protein is more larger than blood. So the porousness we have in that glomerulus is not really that much, but it is much that blood is leaking, but protein is not really leaking because protein is very, very large. Because of that, we are not going to be losing much protein in glomerulonephritis. So due to that, we are not losing protein. The client will not have generalized anasaka. Edema. Anasaka simply means edema of the whole body from your head to your toe, everywhere. So we're not going to see generalized edema. Rather, the edema we might see just periorbital edema around their face, but the body no edema. Are you following? So take note of this. So this is what is happening in glomerulonephritis. And of course, you know that protein helps to maintain the pull and push pressure. We call it the hydrostatic and then oncotic pressure. These two pressure has to be equal and opposite, just like your Newton third law. It has to be equal and opposite. These two pressure, what they do is to prevent fluid not to seep or leak from the capillary or from your blood vessel. Have you ever wondered blood flows through your blood vessel, your aorta and all those things? Why is that? They are like pipe. Why is that the fluid is not leaking by the side? It's due to this hydrostatic pressure and oncotic pressure. It's being maintained by the protein within the blood vessel that is floating within your blood vessel. So anytime we lose a lot of protein, there'll be fluid shifts. And this will lead to what? Thought space. You see fluid entering into the interstitium, into those thought space, such as your pericardial space, your pleural space, your peritoneum. And when fluid enter into this place, it's being lost. The body can't reabsorb them back into the blood. We lose them. Are you following? So take note. So in glomerulonephritis, we are not losing protein that much. So we are not going to be having generalized edema. Edema will just notice just periorbital. Are you following? Why in nephrotic syndrome? In nephrotic syndrome, what is happening there is they're just clusters. They're clusters of signs that we see in a client that actually tells us that this my client might be having problem with the kidney. Are you following? That is what we say nephrotic syndrome. There are just signs and symptoms that I see in a patient that tells me that this my patient, I need to look at him. He might be having kidney problem. That is what we call nephrotic syndrome. So in nephrotic syndrome, this client is losing a lot of protein. We are not losing blood, rather we are losing protein, and the protein is going to be lost so heavily that the client is going to have an ASACA, generalized edema. Now, as we are losing this protein, take note, as we are losing this protein, the liver is primarily responsible for synthesizing and what replacing this protein in the blood. So the liver will try and be replacing the protein. Now, anytime the liver produces protein, there's always something accompanying it. There's a byproduct that will be produced. This is what we call the triglyceride or your cholesterol level. I don't know, in 200 level, when I was doing my nursing, 200 level in physiology, that is physiology 202, that is in biochemistry 202, they taught lipid production, lipid cholesterol synthesis by the liver. Are you following? So when we lose protein, I want you to take note, the liver will produce it quite fine, but something will be produced alongside with it. That is cholesterol. Now, we are losing a lot of protein, right? So the liver is going to be producing those protein. This will lead to excessive what cholesterol level, and this will lead to what hypertriglyceridemia. So take note of that. Now, due to that large protein that we are losing, is going to make the urine to be frosty or foamy. So you see them, they'll have frosty or foamy kind of urine. Now, in nephrotic syndrome, we're not only losing protein, we are also going to lose antithrombin 3. Antithrombin 3 is an anticoagulant. It flows within your body. It helps to prevent your blood not to clot. Now we lose it in nephrotic syndrome through the urine. This client will be at risk for what? Blood clotting, which can lead to DVT, and if you don't manage it, you can have a pulmonary embolism. Now, as we are losing protein, your body uses protein to synthesize your immunoglobulins. Remember, the major protein in your body is your albumin, is one of the major protein, right? Now, when we lose this protein, it simply means we cannot be able to produce immunoglobulins. What are your immunoglobulins? I use GAMED to remember it. GAMED. Like when you're going to a football game. GAMED. 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 G for immunoglobulin G, A for immunoglobulin A, M for immunoglobulin M, E for immunoglobulin E, which is one that mediates your what? Anaphylactic reaction. And then we have D for immunoglobulin D. So when we lose protein, our immunoglobulin level will suppress because the body synthesizes this immunoglobulin from protein. So take note of that. So this client will be at risk for what? Infection. Are you following? So take me. So this is what is happening in glomerulonephritis and as that of a nephrotic syndrome. All right, so walk with me through this question. So let's go. We'll see we're going to get it right now. So now I want to see the one that is peculiar to glomerulonephritis, or the one that is peculiar to nephrotic syndrome, or the one that we see in both, right? So T-colored urine with red blood cell. We are going to see this in glomerulonephritis. Now, because they are losing a lot of blood, remember they are risk for hypertension. But in nephrotic syndrome, we're not losing blood. So what is happening in nephrotic syndrome? That BP can be normal or they will have hypotension. So I want you to take note. So serum albumin of 1.8 with 24-hour protein of 7 grams is low, right? So this is peculiar to what? Nephrotic syndrome. Periorbital edema on walking. Take note. What do we talk about edema when it comes to glomerulonephritis? We say we're going to see periorbital edema. So there's edema, but it's periorbital, right? In nephrotic syndrome, what do we say? We say we're going to see edema is an nasaka. That means all over the body, both in the eye and the rest of them. So due to that, what? It is both. We are seeing edema in both conditions. So we're going to have periorbital edema in both conditions. Are you following? Now, let's continue. Elevated anti-streptolysin. Oh, this is Asotiter. Asotiter is only specific for streptococcal infection, right? It will be positive or elevated if the client is having a strep throat infection. So we know glomerulonephritis is usually caused by streptococcal bacterial infection. So we are going to go for that. Now, serum cholesterol level of 380 milligram per day. Cholesterol level is always less than 200. These are your lipid profile. We have the HDL. I want my HDL to be greater than 50. My LDL is the bad cholesterol. I want it to be less than 100. My triglyceride, I want it to be less than 150. And then my cholesterol, I want it to be less than 200. We're having 380. It is high. It is peculiar in what? Nephrotic syndrome, because we are losing a lot of protein and the liver will synthesize protein. Whenever I produce protein, cholesterol level will rise. So take note of that. Okay, now the last one says hypertension requiring treatment. Remember I told you in nephrotic syndrome, we're not going to see it. We're not going to see hypertension. Rather, we're going to see hypotension or BP will be normal. But in this, they are losing blood, and this will make the body to activate the RAS, renin angiotensin system, and this will lead to elevated blood pressure. All right, so this is it. Have you seen that? It's very, very simple. So if you're wondering where this question is, it's from Vic-Nclex PrepCon. It's Vic-Nclex question bank. So you can visit www.vic-nclexprep.com and then register, and then you upgrade from there. We have 1 month, we have 2 months, we have 3 months, and then we have a 6-month subscription. So take note of that. We have up to 500 and something NGM question, and then total is about 3,300 and something question. We always update it all the time. It's to meet up with the what NCLEX and latest NCLEX test plan. All right, so let's look at our answer, whether we got it correct. Okay, I can see we got it correctly, right? So NCLEX is very, very simple, and you can see our rationales. Our rationale is very, very detailed. It makes you to understand what it is and the rest of it. So that is it. So NCLEX is very, very simple. It is not hard, right? So make sure you subscribe to this channel, because we'll be doing more of this all the time. So do have a lovely day. See you next time, and then we'll be coming more of live very soon. We'll be doing more live, so make sure you always glue to this channel. We'll be doing live here very soon. Maybe starting by next week, we'll be start doing our live classes here very soon. Thank you. Do have a lovely day. Bye.